Ladies and gentlemen, distinguished guests, colleagues, and the media, it is with great pleasure I welcome you here tonight at the Registered Nurses Association of Ontario All-Candidate Meeting in Cobourg. My name is Dr. Angela Cobourg, and I'm the moderator for the evening. The Registered Nurses Association is a non-partisan organization. And truly, this is a momentous occasion because we have the opportunity to meet, read, and discuss health issues with our federal candidates. This event also provides an opportunity for the registered nurses, members of the public, and the media to discuss health issues with our federal politicians. We will be talking on issues such as Medicare, universal pharmacare, social determinants of health, environmental health determinants, and the healthcare system such as public health, home health, primary care, and hospital care. All our questions will focus on health issues. Firstly, I would like to introduce our politicians. The following politicians are here with us tonight. Patricia Sinnott from the Green Party. Kim Rudd from the Liberal Party. And Russ Christensen from the NDP Party. We don't have our candidate from the Conservative Party tonight. So I will just give you a brief introduction about them. We took this off the internet, so it was not there. Patricia Sinnott is a retired pharmacist who has worked in the Durham region in hospital settings. As a hospital pharmacist, she has worked on multidisciplinary teams. During her tenure as a pharmacist, she educated patients about their drug therapy. She is also a lifelong learner. She enrolled in graduate school while her daughter was an undergraduate student, and she received a Master's of Science degree in pharmacy in 1997. Her other interests include music, pets, hiking, genealogy, and storytelling. In 2003, Patricia was appointed by the Council to the Port Hope Community Health Center Steering Committee and became a founding member. As well, she volunteered with Habitat for Humanity, Northumberland. Patricia has served on several Port Hope municipal advisory committees focusing on accessibility, heritage protection, environmental issues, and smoking in public places. In 2010 and again in 2014, Patricia campaigned for election in Port Hope. During those campaigns, she enjoyed many opportunities to promote her beliefs about the environment, sustainability, diversity, social justice, and community development. Patricia would like to see various communities of Northumberland, Peterborough, South, and all of Canada grow healthier and manage their resources, both in the built and natural, in a self-sustainable way. I'll now introduce my next candidate, Ms. Kim Rudd. Kim Rudd has a long history in her riding, both as a local business owner and as a community advocate. She is the past president and owner of Willis College in Cobourg, owner of the Archer's First Aid, CPR, and NC Training Institute, and a co-founder of a local daycare facility. Altogether, she has brought more than 50 jobs to her community, as well as essential training and childcare services. Kim is also an active volunteer with her community. While working with a number of community organizations, she has received much praise, particularly for the integral role she played in attracting 8 new physicians to Cobourg, and for her service as president to the Cobourg Chamber of Commerce. Please welcome Kim. Our next candidate is Ross Christensen. Ross is a member of Tom McLean's NDP team. He has worked as a business consultant and entrepreneur for 25 years. Ross has worked in the private, government, and cooperative sectors, focusing on food and agriculture. Over the last 2 decades, he has helped more than 180 businesses, startups, with an impressive 70% rate of success. He is also a lifelong learner, environmental advocate, and has helped develop the local organic food co-op network. He has also worked with Ontario apple growers to reduce pesticide use and establish a wholesale premium. In 1997, Russ moved onto a forested farm near Campbellston with his wife, Heidi Schaefer, and their 2 children. Russ is proud to make Campbellport, his home.
Yeah, Campbellford. Y'all should come up there sometime.
Russ has never missed a chance to give back to the community he loves. He is a principal local leader who served as founding president for both the Campbellford Seymour Community Foundation and the Aaron Theatre Cooperative. Please welcome Russ.
Are we sharing one mic?
Yes.
I want to sit a bit closer together. I think
yes.
We're going to start throwing it.
We can do that. I may not use
Well, it's against hearing aids or something.
Okay, are you getting closer?
Sure.
Okay, I'd just like to give you the ground rules for tonight's meeting. Only one question pertaining to health and healthcare, including social determinants of health, should be asked. There is no repeat of questions. Each question must relate to the federal issues. They are provincial issues, they are federal, so we are focusing on federal issues. I shall ask all candidates one question on Medicare taken from the Registered Nurses Association of Ontario, brochure called Why Health Matters. Each candidate has 2 minutes to respond to this question. The order of the candidate's response will change with each question, and I do have a bag here to pull names, so I'll get somebody from the audience to pull names. Who's going to go first? It's going to be random. Okay. Okay. Okay, the first person to speak tonight is Patricia Senat. Okay.
We nurses. It's in your blood.
The second person would be Russ Christensen. And the third person is him. Okay, so that's the order, and then we might reverse it so that one person
works for you.
Okay. So following that order, I will also, after asking the first question, I would start the question going as the moderator. After asking that first question, and each candidate has the opportunity to answer that question, then I'll open the microphone, which is in the middle, to some of the organizers of this event, would be registered nurses from Kawartha, Victoria, and from Durham region. And following that, we'll have members of the audience, the community would have opportunities to ask questions. There would be timekeeper, and the timekeeper will give you the time. She is up front, so she will show you when you're speaking, okay? When you have 15 seconds left, and when you have 10 seconds left. Each politician would have at least 2 minutes to answer his or her question.
We're just candidates, we're not politicians yet. Yeah.
So I hope that we would show the indication when your time is up, okay? Is that clear? Are the instructions clear to the audience? Okay, thank you. So, I'll give each candidate a few minutes, not more than 5, to say something about yourself that I didn't say before I start the questioning.
So you're first, Patricia.
Am I first?
Yes.
Well, you stole some of my thunder, I'm afraid, but I will try to not repeat some of what you've heard about me. I'm Patricia Sinnott. I came back to Port Hope 13 years ago and bought my grandparents' house. My father and his brother were raised in this house, so it's wonderful for me to come back to a place where I have so many fond memories of being there as a child visiting grandparents. So this is the house that I've been able to welcome and entertain my own granddaughter. So coming back to Port Hope has been great for me. I really feel rooted in the community. And prior to coming to Port Hope, I lived on the Oak Ridges Moraine in Blackstock. So I've had a perspective of being up high with no view of water and being closer to the lake with a view all up and down the Ganaraska River, which I enjoy thoroughly. So, as was mentioned, I got involved with the steering committee for the Port Hope Community Health Centre soon after arriving in Port Hope, and that health centre opened its doors in 2008. And it's a different kind of way of providing primary health care. Instead of seeing only a doctor, people registered for care at the Community Health Centre see a whole team of healthcare providers, including physiotherapist, dietitian, social worker, mental health worker, the nurse practitioner, and a physician on occasion when necessary. So that's a kind of healthcare that makes a lot of sense to me, and I began getting involved 20 years ago in Durham region, working towards bringing this model of healthcare to Brock Township in the north end of Durham, which I think they're still working on there, but coming to Port Hope with knowledge gained there and being able to step right into a committee here and see it all happen in 2008, that was wonderful. And my background as an acute care hospital pharmacist, I'm very familiar with how we deal with acute illnesses and emergency care in this province, and I see how much of it is preventable, or perhaps better management of chronic conditions could reduce the frequency of people coming to emerge for help with sudden emergencies. So, but I also believe that the social determinants of health are very important too. So in becoming a community advocate, I'm now a volunteer with the Greenwood Coalition in Port Hope. And I was at a meeting last night, and housing is the big priority with that group. And there's a program called Housing First, and Habitat for Humanity is very involved with that. And it's a program that's mentioned in the Green Party platform as well. The concept is that homeless people deserve safe shelter. So rather than trying to deal with their issues around alcohol or other addictions, you just get them off the street into safe housing, and then you wrap around services that support them, keep them safe, feed them with nourishing food, and help them find the services and assistance they need to deal with their mental health issues and addictions. So I really like that concept. So I met Elizabeth May in 2010. I heard her speak and I was so impressed. I joined the Green Party because the Green core values are my values: nonviolence, sustainability, social justice, ecological wisdom, participatory democracy, and respect for diversity. I've had some experience as a candidate municipally in Port Hope, as you heard, and I'm here today. I just got the flag. So I'm very pleased to be here to talk about health issues tonight with you and the RNAO members. Thank you.
Thank you. Thanks everyone for coming out tonight on this rainy night, and thanks to the Registered Nurses Association for organizing this. How many health providers are there here? Quite a few. Okay, well, that's good. That's great. So I'm really glad that we're talking about healthcare as an election issue, because it's often left off the table, and it's actually an extremely important issue. I know Canadians often rank it second, sometimes first in elections, but even then, there usually isn't that much talk about it at all candidates meetings, so it's great to have one that's just about healthcare. I really appreciate that. you've heard about my background, but I also have 2 nurses in my family. So my mother was a nurse. She was originally an operating room nurse in Peace River, Alberta. And my daughter's in 4th year nursing at Queen's University right now. I think she's going to pediatrics or something like that, maybe. She loves babies, what a surprise. So the NDP and public health care go together very strongly. Everyone's heard of Tommy Douglas and how Saskatchewan was the first province in Canada, and indeed in North America, the first jurisdiction to have a public health care system, and then that was brought to the federal government by the NDP in 1962 and brought fully in force in 1970. So when you think about it from that point of view, it hasn't been that long that we've actually had a public health care system. Over the last 10 years, it's been under great attack. Mr. Harper's Conservatives have really wanted to move it towards more privatization. So one of the things they've done to force that is to withdraw over the next 10 years about $36 billion to $40 billion over the next 10 years from the public health care system and funding. And the federal government provides a significant amount of funding. It's about 17 or 18% right now for public health care across Canada, and the provinces are responsible for implementing that and providing the hospital care and other care. So the federal government actually has a very important role. Mr. Harper's ignored that role, and he's never had a meeting with the premier, so he basically just said, this is what you're going to get, and it's just going to be inflation-based and on GDP, and we're going to eliminate the 6% escalator that was under the original health accord. So the NDP will bring that funding back. The other thing that we're going to do is we're going to, you look at the aging population. So today's Statistics Canada released a statistic that for the first time in Canada, there's more people that are 65 years and older than there are people who are 14 and younger. So we have an aging population. I know just 3 weeks ago, my own mother died of dementia and complications around dementia. We need a strategy for Alzheimer's and dementia, and the NDP will bring that in. We need long-term care. The long-term care homes, if you can afford it, in Ontario right now are fine, but if you can't afford it, then you're in trouble. And there's a huge waiting list in Ontario for long-term care, and it's one of the things that's backing up our hospitals. Now, this isn't news. I mean, demographics are demographics, and we can plan for these things, and it's really about inaction. The reason there's older people that don't get the home care and long-term care and other health care needs that they need, because older people use most of the healthcare services, because there hasn't been any planning or any effort or any kind of strategy for this. So the NDP is really serious about bringing those strategies in and making sure the system's properly funded. The other thing we would do is we'd help open, Patricia was talking about community health centers, so we'd open 200 more across Canada. They are a good model. They provide a sort of a more, holistic, integrated care system. It's not just acute care focused. It's focused on the social determinants of health, poverty, housing, addiction, various things like that, and lower education, lack of social interaction. So it's a great model. It's been around for a long time. I think the first ones were actually cooperatives that started in Saskatchewan in the 1920s. In terms of the platform itself for the NDP, there's sort of 5 key points to it. So I've already mentioned the dementia and Alzheimer's strategy. There's a mental health strategy for children and youth. I don't know if you've noticed, but I have. There seems to be increasing anxiety with young people and more depression, and certainly with Aboriginal communities, suicidal issues. Increasing family doctors is the third plank, so we'll hire 7,000 doctors and nurses and nurse practitioners. We've talked about long-term care, and we'll introduce a pharmacare system, which is way overdue.
Thank you. And thank you everyone for coming tonight. This is our 7th debate, I believe, and we learned something new at each one. It has been, I think in general, the 3 of us up here will agree on many planks in terms of what needs to be done in terms of healthcare. And your Why Healthcare Matters, which I've read over the past few days, pretty well sums it up. And I think the only party that has some issue with this is not here tonight. So the challenge in some ways is to tell you where we disagree. Well, there aren't many places. We all believe pharmacare is a necessary thing, social housing, and when I say social housing, I'm really talking about affordable housing. We made a $20 billion announcement to affordable housing with a particular emphasis on seniors and senior facilities. It goes to the comments that you heard about our demographics. We know that's where the need is going to be. There's some really interesting, I mean, I can tell you all the stats and I can tell you the party platform and I can do that, but I think we'll get to that in questions. I guess one of the things I want us really to think about is what we want to look like as a country 10, 20, 30, 40 years down the road. What conditions do we want our seniors living in? What quality of health? I was talking to a CARP debate we were at a couple of weeks ago, and one of the things that one of the organizers said is that when they were doing, 30 years ago, when they were doing the actuarial reports about how long you live, how long you have to plan for your retirement, you know, they were in the 70s. Right now they're saying if you're 30 years old right now, it's 91 for men and 93 for women. And part of that has to do with our health care, about better care, better drugs, all those things. But that raises a whole nother issue in terms of the capacity of the system. Our provinces have been without what I will call a federal leadership role for the past 10 years. We have a healthcare code that expired in 2014. Stephen Harper, you can't write these things on the back of a napkin. You're negotiating with every province and territory to come to an agreement about the framework. It expired in 2014. He gave it a 2-year grace, if you will. It's expiring again next year. And he's cut the escalator. So where provinces thought they had X number of dollars to deal with, their escalator was cut in half. When provinces are trying to plan for what this is all going to look like 10, 20, 30 years down the road, they're missing a lot of things. They've been missing federal leadership. They're missing the information that came from the long-form census. That was a huge predictor of what we needed and what it needed to look like and what resources we need to put into it. So in terms of policy and platform, and the Liberal Party we have come out with a number of things as it regards to healthcare platform, but we still have 2.5 weeks to go, and our formal healthcare announcement is yet to come, but we do know some of the things in there. An example would be of the pharmacare. It was a policy brought to the convention floor and it passed with 92%. The right to die with dignity is just all part of this conversation. And I go back to housing security and food security and those things that are some of the determinants of health. They all weave in and out of this healthcare discussion. Healthcare discussion is not on its own. So as we go forward tonight, I hope we'll get lots of good questions. I've lived in this community for almost 40 years. I should tell you a little bit something about me personally. I have 2 daughters in their mid-30s and 3 grandchildren. And I'm doing this. I'm running to be your MP because I have lived here for almost 40 years. I've seen some of the challenges. I've seen some of the things that we have lost. And I see some of the opportunities that we have. Healthcare is going to be, with the new riding particularly, we have one of the largest senior populations as a riding in Ontario. So this is not a conversation just about tonight. I hope I learn as much from you as I can provide to you information from your questions. So thank you very much.
Thank you very much. Some of you have already touched on the question I was going to pose, but I will still pose that question. Canadians cherish the principle of equitable health care for all. Unfortunately, some key services are missing from the current healthcare system, such as home care and universal pharmacare program. Canada is the only GA country without a national pharmacare program, resulting in costly drugs for those who need it. If your party was elected as the government of Canada, Would you expand universally accessible, publicly funded, non-for-profit healthcare system to include home care and a national pharmacare program? So our first candidate, as from the names that were drawn, is Patricia.
Do you want to
No,
rotate
no,
it?
we'll rotate afterwards.
Oh, okay.
Okay, so yes, indeed, the Green Party fully supports adding what's missing to Canada's universal public health care program that is a not-for-profit system. And the National Pharmacare Plan proposed by the Green Party would be saving $11 billion a year because of the advantages of group drug purchasing, buying in bulk. Right now we've got 10 provinces and territories, each has its own drug formulary or list of approved drugs for which the program pays. And by consolidating and pulling that all together, we believe that there are large savings to be had. And it'll be better coverage for everyone, and it will actually save money in the long run. We also believe that everyone has the right to access to quality person-centered health care, and that health care should be available 24/7. That interdisciplinary team care should be available 24/7. Right now it's not, which is why people end up in emergency departments, particularly on holidays or off hours. And there they get episodic care, and of course because of triage, they're often made to wait for considerable lengths of time, depending on how sick or serious their needs really are. So yes, the Green Party will support more home care for seniors. The concept of aging at home is one that we fully endorse. And we would also make it easier for seniors to access equity in their homes, to use that to pay for expenses that come up by aging at home, aging in place. And yes, we support death with dignity. Thanks.
Thank you very much. Our next candidate.
Thank you. I know Kim said earlier that the parties agree on everything, but we don't. So just to be clear. Well, okay, you can have your say in a minute. I'd just like to let people remember, if there's any history buffs out there, Mackenzie King, who was a Liberal Prime Minister, promised a public health care system since the 1940s, election after election after election, and the CCF did it in Saskatchewan with Tommy Douglas, and then they brought it to the federal government in the 60s, and because there was a minority government in the 60s with Lester B. Pearson, we actually got a public health care system after it was denied for many years. It's kind of like we were going to get a national child care system from the Liberal government since 1993, but we never did. So you have to think about who you can trust in an election to make things happen. In terms of universal pharmacare, I've already talked about that, and I think what Patricia said is really important about the savings that the system will have from a national drug plan, because it's $11 billion, that's the estimate that we would save. That just happens to be a couple $1 billion short of the corporate tax cuts that the Liberal government and the Conservative government made over the last number of years. So while they're cutting revenues, they're also providing drug companies with very tidy profits, and I think we can do a lot better than that. In terms of the home care, we do have in the platform a fully costed home care system that we want to help introduce together with the provinces. Like Kim was saying earlier, the Prime Minister needs to meet with the premiers, and the federal health minister needs to meet with the provincial ministers and negotiate these things and work them out to make sure that we have an equitable system right across the country.
Thank you.
Thank you. Well, I don't really want to spend my evening talking about Mackenzie King because I wasn't around and I have no idea what motivation was for what he did. But you're absolutely right, Russ. There's no question Tommy Douglas brought the National Healthcare Program to Ottawa, and it was under a Liberal Prime Minister, Lester B. Pearson, that it passed. So I'd rather talk about things we're going to do than the history, and so I'm going to. I want to talk about a National Pharmacare program. Some of you may know Dr. Bill Wensley. He lives in Cobourg. He used to be chair of the Ontario Pharmacists Association. Registrar of the Ontario College. Thank you, Patricia. I have trouble with that. Anyway, Bill was the one who actually wrote the policy that was accepted at the Liberal Convention. So it actually came from this writing. And he went and met with some experts in Ottawa, at the University of Ottawa, to come up with what made sense. Because we are in a different era than we were 10, 20, 30 years ago, because of all the things we've talked about. You know, one of the things that jumped out to me, a couple of things. One, as owner and president of Willis College, we graduated, I can't tell you how many personal support workers that went into local nursing homes and retirement homes and did home care. And I know the work they do and value the work they do. So there is a whole, I guess, larger picture of various disciplines out there that are contributing in some way, all finding themselves getting close to burnout, personally, I think. But I guess I want to talk about what a National Pharmacare plan could do. And I'm going to have to talk about later because I just got 15 seconds. But I will. Thank you.
Thank you very much. And the part B to that question, this question is, if your party is elected as the Government of Canada, would you enforce the principles of the Canada Health Act and negotiate a new health accord including increases in health transfer? So now we're going to reverse the order. Okay, so we could have, yes.
You want me first?
Yes.
Okay, so the answer to both those questions is yes and yes. And I think the federal government has really not fulfilled its role as a leader in any way on public health care, and it's simply because the Conservative government doesn't want public health care. They would like to starve it of resources, and then over time, people will get less and less satisfied with the service it provides, and it'll become a self-fulfilling prophecy that we therefore need to have private health care. Now, if you do the math on that, the reality is that private health care in general costs about 18% more than public health care. And when you're talking about hundreds of billions of dollars, that's a lot of money. So we really know from our own experience here in Canada that a public single-payer system that's equitable across all provinces and is available to people of all financial means is the best way to provide health care. And it's a fundamental human need and right. So what we need to do better in terms of that is working together with the provinces to look at more preventative healthcare strategies, things like the social determinants of health, but also food and nutrition, looking at special communities like Aboriginal communities, making sure that those communities, which have, in many cases, just terrible healthcare situations, and they need a lot more help than other communities, so we need to step up to the plate there. And I think, you know, that's a measure of how compassionate a society is, how well the society takes care of people who are less fortunate. And that's what Canada is really about from my point of view. And I think that by working together, cooperatively, and finding those creative solutions, because there's a lot of really smart, innovative people in the healthcare system, we will find those solutions.
Thank you.
Is it coming up?
Yes.
Okay. We'll get this. Sorry.
Thank you. Looking forward, Justin Trudeau has made a commitment to meet with the premiers and health ministers within 90 days of forming government. We have to negotiate a new healthcare accord. What we have now is, as I said, is expiring next year. The provinces want a partner. They, in the absence of federal leadership, have been trying to figure this out on their own and trying to guess what's coming next. So as we look at what the provinces are struggling with, and not just in Ontario, this is across the country, we recognize that they have to plan. They have to plan beyond next year. And things like home care, things like pharmacare, and also long-term care have a provincial responsibility. So the federal government's job is to negotiate a framework that all the provinces can operate within. And do you remember some years ago when the Ontario government tried to privatize certain parts of healthcare? And they were said, no, no, you can't do that. And there was a string that was threatened to be pulled back. Attached to that string is money. And sad though it is, sometimes that is the motivator for making sure that we keep our healthcare that we've negotiated. So you will see a very strong negotiating team with the provinces and the federal government negotiating what's best for healthcare in Canada. I guess the other thing I want to say about innovation and research, and it's one of the things that was announced yesterday and today by our party, is I think it's $200 million in innovation and research and science. One of the ways we're going to tackle this problem we have is by getting to the next step of what that innovation is that allows us to do things we do better, have more equipment, have better drugs, better services, and how we can provide new and better things. It's not an easy task, but it's something we have to do.
Thank you. I now open the microphone for.
No, Patricia.
Sorry, Patricia. Sorry.
The Green Party definitely recognizes the importance of strengthening the Canada Health Accord, and the Green Party would form a Council of Canadian Governments. This brings to the same table the federal level, provincial territorial leaders, and municipal local leaders, plus First Nations, Métis, and Inuit leaders all together. And it is at that level that policy would be developed and programs would flow. So by doing that, not only are we making up for the lack of the Conservative leader not consulting with the provinces over healthcare and healthcare spending and reducing budgets for healthcare, but we're expanding it even further to include particularly First Nations people at the table, because we do not want to make decisions for them or take care of them. They are equal, and they need to be with us in planning and making decisions so that we can be more effective in giving equality of access to services needed across this country. Right now, it's very hit and miss as to how easy it is for you to get what you need depending on where you live. So also the Green Party will develop a number of strategies, including one for seniors, one for dementia, one for housing, one for energy, and a guaranteed livable income. I just mentioned these because income is sometimes a very important thing for people and does affect their health status directly. So that's something that we would ease people's minds by giving them the assurance that that would be something they needn't worry about. So thank you for the question.
Thank you very much. So the microphone is now open for some of the leaders who organized this all-candidate meeting tonight from Victoria, Kawartha, as well as Durham. So you could take your place at the microphone to ask your questions. And we will change the order a bit for the candidates to respond. We will now start with the person who spoke last to answer first, and the first person goes second, and vice versa.
Okay, you'll keep it
Yeah,
straight
keep
for us.
us on
Thank you
track.
very much. That's good.
Good evening. In 2011, Cobourg's census was 18,519, an increase of 1.7% from when the census was previously completed in 2006. Of this, the largest age bracket is 60 to 64. Nurse practitioners.
I don't think your mic is on.
Your microphone is not on, and we can't hear what you're saying.
Well, you just have to start
I will
over.
start again.
There you go.
Yeah.
Yay.
Okay.
All
I
right.
think it's on, you just have to get closer.
Okay. Actually, you know what? I'll take it right out.
There you go.
In 2011, better? Okay. Cobourg's census was 18,519, an increase of 1.7% from when the census was previously completed in 2006. Of this, the largest age bracket is 60 to 64. Nurse practitioners and registered nurses play integral roles in addressing health needs and shaping health behaviors. How would your party, if elected, support the expanding role of the nurse practitioner and registered nurse to promote and maintain health of the Cobourg population, especially those in the largest age bracket?
I thank you for the question. And as I mentioned earlier, my involvement with the Community Health Centre in Port Hope, I certainly recognize the wonderful role that nurse practitioners and registered nurses play in primary health care. And I think the government, the provincial government here, is finally coming to grips with the fact that they're very effective at providing good quality health care for people. We don't need to see a physician every time. We don't need to see a doctor to get a renewal on a prescription or to have various chronic conditions checked or assessed. So, and I know that the role of nurse practitioners has expanded as far as prescribing and other, and registered nurses, of course, support nurse practitioners in those roles. So yes, I very much support expanding those roles, as the role of the pharmacist is also expanding. As you know, with immunizations available through your community pharmacist rather than having to go to your doctor's office. So there's a lot of ways to change how we deliver primary health care through a variety of healthcare providers, including nurses, nurse practitioners, pharmacists, and others. So I'm certainly, myself and the Green Party, very supportive of that.
Thank you. So now we'll have Ross.
Oh, thanks for calling me by my first name. That's much better. You know, it's important for us to increase the number of doctors, nurses, nurse practitioners, and other healthcare providers, because a lot of people don't have even a family doctor. And certainly nurse practitioners and nurses can fill some of that role, definitely. And I think, you know, just to remind people, this is about healing. That's what it's really about. So it's not necessarily just about, you know, medications or immunization. It's about actually having a human touch. And I think that's maybe the single most important thing that nurses do as primary healthcare providers. They provide the healing hands and the soothing voice, and I think that's actually a really important part of healing that is kind of neglected a little bit now because we're so deeply into technological and you know, pharmaceutical sort of treatments. Nurse practitioners are going to continue to expand as a practice, which is great, and the NDP fully supports that. And like I said earlier, it's in our platform that we would hire 7,000 doctors, nurses, and nurse practitioners over the next 3 years to help fill the gap. It's only a beginning, but we need to have a long-term plan around what we're going to do with this aging population that was in the question, the 60 to 64. But there's also, you know, the older group too, right? As I was talking about, the baby boomers, 65 and plus. So that's something that we really need to come to grips with. Otherwise, it's going to hit us like a brick, and we're not going to be ready, and it's going to be a disaster.
Okay, we'll now have Kim respond to that question.
I honestly, and this is my personal opinion, I honestly think that we're not going to have any option in this country but to turn healthcare on its head. We have a system that's 50, 60 years old that we bring Band-Aids on and plugs in to try and make it work with the old, so what we look like as a country 40, 50, 60 years ago. What that means, certainly nurse practitioners and registered nurses are what I will call the on-the-ground care. There's probably a better term for it, but that's the one that comes to my mind. And it's the role that gets us into places that sometimes otherwise we wouldn't be able to get into in terms of healthcare. And I'm thinking of the North, and I'm thinking of some Aboriginal communities and rural communities, even within this riding, where there is no access for people. They don't have transportation. They live in very rural communities. This riding has changed significantly since the last election. And transportation is even more of an issue for this riding than it used to be. So certainly that's one thing. And the other thing, I guess, you know, the innovation will not just be about technology. The innovation will be how we manage our human resource. What's the most efficient and effective way to do it? And again, going back to the healthcare court, as a federal government, the only place we hire as a federal government, nurses and doctors is either the armed forces or Aboriginal communities by providing direct funding. But within that healthcare accord, that's where you negotiate those terms. So it's, for me, I guess, the innovation part will become key. How we get the best services to people, not people to services. And that's the main change I see for our healthcare going forward.
Thank you very much. So we now have another question from one of the leaders organizing this all-candidate meeting.
Good evening. My name is Kathy Graham. Can you hear me?
Yeah.
And I'm a registered nurse, and I am a member of the Kawartha Victoria chapter. I've got a couple of hats here tonight with this question. The other one is I teach at Trent University, and I just recently worked with a group of fourth-year students that focused on a course around socio-political action. And one of the groups that I worked with really wanted to focus their work around elder abuse. And I suggested that she submit her issue, her question to our chapter, and it would be posted in all candidates meetings. So I'm going to read verbatim from her letter. She says, presently in Canada, over 15% of the population are 65 or older. This percentage is expected to rise with the aging baby boomer population. It's estimated that 10% of seniors are subjected to abuse, which means that in 2014 alone, over 500,000 seniors could have experienced some form of abuse. Our regulatory body, the College of Nurses of Ontario, identifies within our standards that clients should be protected from abuse, as well as that abuse should be stopped and reported. And within the best practice guidelines for the organization, the RNAO, recommends appropriate screening if abuse or neglect of the elderly is suspected. If abuse screening becomes mandatory for all individuals over the age of 65, nurses could protect a greater percentage of aging adults. So my question from the student is about your views on mandatory abuse screening and how you plan to protect the aging population should you be elected.
Okay, the order now would be Kim first.
Can I get a clarification?
Thank you. I'll use the mic. Just a clarification. Do we do abuse screening now?
We do in some sectors,
Okay.
but in others we don't. And this is also directed at the federal level as well. There are abuse screening mechanisms in the province of Ontario, but not across all health sectors, no.
Interesting. Thank you. Well, again, I learned something new. I don't see anywhere where anyone would not want to have that applied to every single senior in this country. If there is any suspicion, we do it with children. I mean, I worked in childcare for 20 years, and if we, even though I was not an early childhood educator, because I worked at the center, even though it was administration, I had a fiduciary responsibility to report even if I considered it was a possibility. And the expansion of that, I think, is what you're talking about, that just covers all sectors. So to me, I think it makes perfect sense.
Okay, we go to Russ and then Patricia.
Thank you. That sounds like a very good idea, to have mandatory screening. I'm a little surprised it's not there now, because I didn't know that. I thought it would have been. And it makes good sense, and it's great that your student is concerned about it, and that, you know, there's courses like this being taught, because this is kind of what I was talking about earlier, like it's the soft touch stuff and the political dynamics and the social dynamics, gender dynamics that are going on that really impact people's health, but also the caregivers. So we also need to find ways to take care of the caregivers because they're often neglected. Whether they're professionals or whether they're family members that are caregivers for people that have health issues at home or whatever. So yeah, we would definitely support that, and it's just sensible, it makes a lot of sense.
I'm thinking back to screening for alcohol use as part of a physical assessment, and I have read research saying how poorly physicians do at that sort of thing. So I'm thinking of the challenges of doing mandatory abuse screening for the elderly, because particularly if you're dealing with an elderly person who has some degree of dementia, you might be relying on the caregiver's response, and indeed the caregiver could be the person verbally or physically abusing
Or financially.
yes, taking advantage of their parent or whoever. So it's a very complicated thing, and I'd be really interested in seeing what the screening criteria would look like, because I'm trying to think, well, how could you fit all of that in there? And I mean, we know that abuse happens, and we've seen what happened in Peterborough at the long-term care home, where the son of a client living there had left a video camera in the room, and it was, you know, abuse involving staff at that facility. And that is shocking and frightening. So, but this was a nonverbal person, so how could that person testify? The son suspected, thank goodness he did something about it. But I mean, is that what we need to do? Have surveillance cameras everywhere? That's kind of extreme, but I'm just posing the question because I think it's a really complicated issue. And having cared for my mother with dementia, I know how challenging it is.
Thank you.
Thank you.
Okay, so now Kim, it's your turn.
No, I am.
You answer? Okay. All right. So
I think we all have.
You all have. Okay, are there any other? Okay, please come to the microphone.
Part of the question that's already been
You have to speak in the mic.
Oh, sorry. Part of the question has already been answered, but I'm going to ask it again. The unemployment rate is higher in Cobourg and the median income less. Oh, sorry. The unemployment rate is higher in Cobourg and the median income less than in the province of Ontario. Given the importance of social determinants of health, how will your party, if elected, help support the Cobourg population in the areas of housing and employment?
Yes.
Great question. A couple of things. One, yes, the unemployment rate in this riding is at least 7%. Rumor has it it's closer to 8.5%, but it's hard to get hard statistics. What we know is that the youth unemployment rate is actually around 14%, double what the national average is. So we have a real problem with unemployment, and to your point, and that leads to the median income issue. It also, part of what leads to that issue as well is that we've lost so many good paying jobs. We've lost those craft manufacturing and the Strapex and there are a number of them. And they've been replaced with minimum wage or a bit better than minimum wage jobs. So what you end up with is more families struggling, and those societal supports like their housing and things like that are stretched to the limit. So as I said earlier, we've committed $20 billion for affordable housing. We think that is a key element. I also released last Wednesday night, I happen to have a copy with me. It's a plan to create jobs in Northumberland County, and today we announced as a national party a national plan that this fits absolutely into in terms of the sector by sector and cluster innovation around job creation. So I'm very excited by that. We do have to create jobs, but it can't just be about jobs. It has to be about jobs that pay a decent wage, because we just have to look at downtown Cobourg. Our downtown's struggling because people don't have disposable income to go and shop in the stores. They don't have disposable income to go out for a meal. And that's because they're making ends meet, maybe, and barely. So there are a lot of challenges that will be solved with decent paying jobs, with housing. You know, one of the biggest increased groups of food bank use is seniors. That's who the biggest increase is coming from. So we've got a whole bunch of work to do. Oh, thank you. There goes Jen.
Thank you. We go to Patricia and then Ross.
Thank you for the question. Yes, not only do we have a lot of people unemployed because we've lost some good manufacturing jobs in this area, but we also have many people underemployed or precariously employed. Since becoming the Green candidate, I've met several young people with university degrees who are working in the hospitality industry on a part-time basis, as many hours per week as they can get, but that's not what they were educated to do, and they're really hoping that there will be opportunities to get away from doing what they're doing now, but they have to pay the bills, so that's what they do. So the Green Party has many strategies and ideas, but I'll just mention to you, right now, the federal government is subsidizing big oil to the tune of $1.3 billion per year. So Greens will stop that and take that money and invest it in clean technology development, because we believe that developing clean technology and renewable energy will create jobs all across the country, and good paying jobs. And there will also be support for youth to do apprenticeship programs or learn as they're working. And another feature from the Green Party is to invest 1 point of GST every year into municipal infrastructure. So that's $6.4 billion. And municipal infrastructure would then be upgrading roads and bridges and building affordable housing, 20,000 units the first year, and also renovating existing stock of affordable housing, because that has to be upgraded at intervals too. We'll also invest in conserving energy by retrofitting with insulation, low-flow toilets, all that. And that's more jobs for people in Cobourg. Thanks.
Thank you.
So here we are talking about healthcare, and of course we always come back to jobs and the economy in these all candidates meetings. So in terms of job creation, there's sort of three sources of job creation. So there's small and medium-sized enterprises, including startup businesses. There's large corporations that create jobs and maintain jobs, and then there's government. And so healthcare is actually a big economic driver and job creator in our society, and people need to understand that. I know in Campbellford, if we didn't have that hospital there and the long-term care home, our community probably wouldn't be there, because people wouldn't come to retire there because there wouldn't be a hospital or that kind of healthcare. So it's an economic driver for communities as well, and that's government funded. In terms of affordable housing, the New Democratic Party's platform has an affordable housing strategy. In 1995, the finance minister at the time, Mr. Martin, the Liberal finance minister, cut all the funding for social housing and cooperative housing. That then played into Mike Harris's hands in Ontario as the Conservative Premier, and he cancelled all the contracts for affordable housing and cooperative housing and promised the private sector would build the affordable housing. Of course they didn't, and we all know about the prices of homes in Toronto. So one thing that you see, and not just in Cobourg but across Canada, is a lot of poor elderly women, single women. And they are not getting enough money on guaranteed income supplements, so we would double that right away and pull 200,000 women, mostly women, it's not just women, but that's a majority, out of poverty immediately. And there's no reason why we can't do that right away. In terms of job creation, we would encourage small businesses to create jobs. They create about 80% of the jobs. And we would have paid internships for young people instead of unpaid internships.
Thank you. Are there any of the other leaders coming forward? Otherwise, the microphones are open to the public, general public. So you have questions, you could come up.
Hi, can you hear me? No, you have to speak into it a bit. Can people hear me now?
Yeah.
Okay, hi, my name is Dorothea. I'm a RNAO exec member for membership to the Durham Northumberland chapter, and my question is this. We briefly spoke about the distinction between federal and provincial responsibilities in healthcare. And at the federal level, I think they're the biggest driver so far. There's a huge distinction when you look at healthcare that's provided to Aboriginal populations. That's totally federally funded. So with cuts to or from that federal system, we'll see huge impacts on our Aboriginal populations. And as we know it now, that would have an enormous impact on the social determinants of health and subsequently their health outcomes, particularly around diabetes, harm reduction, alcohol abuse, and substance misuse. So if you guys are elected into government, what would be your views and responsibilities related to the social determinants of health, and what would you carry through as your obligation
You're not
to
hearing
that
you.
population?
You're not hearing.
Still can't hear me?
I can't hear you.
Okay, so my question, can you hear me now? My
Put it
question,
right by your mouth.
my question,
Yes.
wow, I'm gonna catch a cold.
Uh-oh.
So my question to you is, with the federal funding that's specific to Aboriginal population health, we know Aboriginals, they face many health issues, more so than our average community. We see huge increases in diabetes, substance misuse, and alcoholism, and that's not even to go along with any maternal child issues. So with those health issues and the federal responsibility towards Aboriginal health, what would your view be on sustaining and addressing the social determinants of health for Aboriginal populations?
And we start with Ross first.
Okay, thanks for the question, Dorothea. That was my mother's name too. Yeah. So Aboriginal healthcare, I mean, we really should be ashamed of ourselves as a society because we're really leaving these people behind. And we have two First Nations in our riding. We have Alderville First Nation and we have Kawartha First Nation. And some of the more remote First Nations have some more serious issues around water and housing and food, and the NDP in terms of social determinants of health. We just announced today, Tom Mulcair announced a program to get good, nutritious food and accessible food to northern Aboriginal communities, because that is a total failure right now. And they're not getting decent food up there, and it's way too expensive. So that program was basically cut by the Harper government. In terms of working together with the Aboriginal communities, the NDP has an approach that is nation to nation. So the federal government would deal with each First Nation and determine its needs together, what the priorities are, and then work on those priorities together to make sure that the communities are healthy, that we're dealing with those basic social determinants like housing, food and nutrition, access to social activities, income levels, all the different social determinants of health, so that we could ensure that we not only prevent disease, but hopefully help people have a happier life in general. And those communities, I've worked on a number of First Nations communities in my work over the last 30 years. And I've seen some pretty heartbreaking things, like little children sniffing gasoline on the side of a road and frying their brains. And we don't need that. And the reason for that is because they need help in those communities in terms of the adults around housing, education, job creation, and just building a community.
Okay, we'll go to Kim and then Patricia.
So, one of the things I'm most proud of about the Liberal Party are the teams that they've created around various sectors and issues. And I was honored to be appointed to the National Economic Team for Justin Trudeau. We also have an Aboriginal team, and we have a health team, and we have an environment team, and we have a veterans team. And those teams came together with other experts and came up with our policies and platform. And we announced our Aboriginal one a couple of weeks ago. A couple of the highlights really are around lifting the 2% cap that has been on their funding for way, way too long. They have not had an increase in years, certainly not since the Harper government has come. The other thing is around the education funding and ensuring that on-reserve funding dollars per pupil are the same for those students as it is off-reserve. Right now they are funded significantly less, and if we want to talk about how we lift people out of lift people out of the experiences they're having that are not healthy, either for their personal being or their community or their culture or their society, is by education. we have to change the path. And we do that with education. We also made a significant announcement on infrastructure, and someone mentioned water. We all heard and hear the horror stories of no water, no housing, 20 people living in a place with no heat in the winter, no access by roads. And when we take that and add the healthcare piece on top, if they're not getting food and shelter and water in their communities, they're also not getting enough healthcare in their communities because their needs are so great, it is challenging to deal with it. So there will be more about that in the healthcare announcement. Thank you.
I mentioned this earlier, the Green Party's plan to develop a council of Canadian governments to include federal, provincial, local leaders and First Nations leaders as well as Métis and Inuit, and to sit down together and do policy planning together. So rather than treating the First Nations as a separate entity, we want to include them around the table so that we're all talking about the same thing at the same time. It's a very different approach. And we want to respectfully ask First Nations leaders, do you want us to get rid of the Indian Act? And if they say yes, then it's gone. So all of this business of funding stuff on reserves through the Indian Act is out the window. So we need to give First Nations leaders the opportunity to have that conversation respectfully, and this all flows from the Truth and Reconciliation Commission. Rather than treating them as distinct, they're another nation, but they're part of this country, and if you read A Fair Country, John Ralston Saul wrote in 2008, he talks about 3 founding nations in Canada: First Nations, the French, and the English. And they're all equal in terms of the society we have today and the values we have today. We need to give credit to those people who were here before us and treat them with respect and not be caretakers of them. So it's a different way of looking at things. But yes, education has been underfunded for years. I am pleased to see the solar farm development at Alderville because they've taken hold of a need. They're using renewables and they've got a big installation going that's going to give them revenue for years to come. So good on them. They didn't wait for help, they just did it. Thanks.
Thank you. So are there other questions from the public?
Can you hear me?
Great, yes.
Hi, my name is Clay Samus, and I'm a veteran. And since we're meeting in the Legion tonight to talk about health issues, I'd like to know what your party is prepared to do on veterans' health issues. Since the new Veterans Charter was introduced in 2006, and wounded veterans now are given a lump sum and shoved out the door, basically facing a life of poverty. What will each of your parties do to improve the care that our veterans are getting in Canada?
We start with Pat at this time. Pat? Patricia, sorry.
Okay, great question, thank you, and very appropriate in this place. Yes, indeed, the Green Party would reopen the veterans offices that were closed across Canada because we believe that veterans need to speak to a person, face-to-face conversation to sort out their needs and get problems addressed. And we would increase funding to support veterans, and we would reinstate the pension rather than the lump sum payment. We think it makes better sense to have long-term support for all of our veterans. Now, just veering slightly from that subject, because we have a value, we value nonviolence, the Green Party would like to see Canada's military role return to what it used to be in terms of peacekeeper and disaster relief and training of local police and other security forces in countries around the world, rather than have a military in this country that is sent out on combat missions. Thanks.
Thank you. Now go to Ross.
Thanks. Well, some people have called the NDP leader, Angry Tom, but you're going to see Angry Russ, because this really makes me angry, where the Harper government aligns itself and waves a flag with the Canadian military, and they have these overseas missions, and people are killed or they're injured or they come back with PTSD, and then when they come home, they're basically just, like you said, set outside and just ignored. So from my point of view, that's just not acceptable. And what we need to do, the NDP, like Patricia said for the Green Party, we would reopen the veterans' offices that were closed by the Harper government, and we would also get rid of that lump sum payment and go back to a pension for injured, and injured can include PTSD, it's not just physical injuries. Injured veterans. From my understanding, because my brother has PTSD, he used to serve in the RCMP, it never gets better. That's my understanding. I'm not a doctor, but that's what I understand. So it's not something you can cure. So people need some extra help with that, and that's what the NDP would support. We would want to treat the veterans with the respect that they deserve and provide them with a living that they can live with dignity.
I'm not going to get angry, but I am going to get pretty passionate. My grandfather passed away in his 40s, leaving a 2-year-old, a 5-year-old, and a 7-year-old from the effects of the gases in the war, and left my grandmother in a wheelchair to raise 3 boys on a veteran's pension. So I am passionate about this. I was a member of the Ladies Auxiliary here for years because of it, but had to give it up because I'm too busy doing this now. The Liberal Party is committed to it's not just about restoring the pension. We've given veterans an option, the pension or the lump sum. They get to choose. We too will restore the 9 veterans offices. And I think one of the most important things, in the announcement, was the option for veterans coming out of the forces to receive up to 4 years of paid post-secondary education. Whether they want to go into a trade or get a university degree or a college degree or whatever they want. They have given us their being, if you will, for service, and we owe them at least that. When the horses came through on the ride, the veterans ride, they came through Northumberland, I was talking to a young woman. She was only just 50. She'd served her full time, 30 years. And she had, I guess she was 52. Since 50, she'd been waiting 2 years to get her first appointment. And she has operational stress injury, which is like PTSD, only from a different, I guess, it comes from a different operation, because it wasn't combat as much as it was within the local forces. But equally as important. And it was 2 years, and she was just getting her first appointment with her counselor. Unfortunately, we lost more veterans to suicide than we did in the Afghan war. And that should be the biggest message about what we need to do for our veterans.
Thank you. Are there other questions from the public?
What's getting busy now?
Hi there.
Oh, you might
Can you hear me?
Yeah, if you talk right into it, we can hear you.
You're like a rock star. Okay, my name is Peggy Smith, and I'm an RPN at the hospital. And you've answered a lot of questions about the health court, which I had on my mind. I work side by side with RNs every day. We've seen healthcare cuts. Everybody knows it. We're looking at $36 billion healthcare cuts across the country. My big question now is, since everybody's answered everything else, is the for-profit clinics. They're popping up all over across Canada. They're charging user fees above what other plans cover for surgeries and diagnostics that are needed. And I just want to know, will you hold single-tier healthcare under the Canada Health Act as a priority with your campaign? Thank you.
Thank you. So we are going to start with Kim.
The healthcare accord, which, as you said, we've talked about, the priority within the healthcare negotiations of every province, and certainly from our perspective as the Liberal Party, is to ensure that we negotiate a system that doesn't allow for people to, I don't not jump the queue is the right term, but certainly a lot of these private clinics are being put in place so people can get to the head of the line. And we've always had a country, we've always been a country and had a healthcare system where you have the right and access to healthcare the same as the person who unfortunately is living on the street in Toronto, or whether you're the person who has a lot of means. Healthcare has, in this country, is traditionally been open to every single person, no matter their lot in life, if you will. And the healthcare accord is where that negotiation has to be strong and determined to make sure that we keep it. And the Liberal Party of Canada has made that very clear. Thank you.
Okay, we next go to Patricia.
Yes, the Green Party supports a single-payer public healthcare system, not for-profit clinics. At the same time, I realized that when I was working in the York Region Dialysis Program and a private dialysis clinic got set up, they were creaming off the easy-to-manage people that were not complicated. And the same thing happened years ago when I worked at the Oshawa General Hospital, and the same radiologist that headed the department in the hospital opened a private clinic down the street and was doing a lot of the same diagnostic imaging services. So what's complex is done by the hospital. What's easy gets creamed off to be done in the private clinic down the road. So it's not really a new problem. The extra billing issue is a big concern because I thought we tried to do away with that 20 years ago, but obviously it's creeping back in again, and there are people with money who want to be first. So yes, I agree, we need to tighten the rules and make sure that everybody has equitable access to services when needed. Thanks.
Thank you.
Okay, so we've had a Liberal government here in Ontario for quite a few years now, and there's been lots of privatization under that Liberal government. We've seen P3 hospitals. The Auditor General's report of Ontario just came out in the last couple of weeks, and it was $8 billion that they've estimated it cost the Ontario taxpayers. $8 billion more to build P3 hospitals than if the public would have built them for ourselves. So privatization, MRI clinics, cataracts, just private medical clinics, all these things are happening in Ontario right now under a Liberal government. So you have to ask yourself, who do I trust in terms of federally, Liberal, Conservative, NDP, Green? Who do I trust to actually take care of our public health care system? That is the fundamental question of the evening, to be honest. And so let's just think about the track record of the different parties, because the past behavior is the best predictor of future behavior. And I'm personally really tired of those broken Liberal promises. Kathleen Wynne never promised to privatize Hydro One either, but she's going ahead and doing it. So I don't trust the Liberals, and I definitely don't trust Mr. Harper, because he would love to see a privatized system. Through these free trade agreements that he's negotiating in secret, they're not debated in Parliament, so we've got CETA, we've got the Trans-Pacific Partnership. Those open up public health care as well to private service from Europe, from other countries, from corporations. We have to stop that from happening, or we're going to lose one of the things that really helps us identify ourselves as Canadians. We not only have to keep our public health care system, we need to improve it and build upon it.
Questions from the public, please come up to the microphone.
Hi, my name is Joyce, and I've just moved back to Ontario from Alberta. Been there for 30 years, but I grew up and raised in Port Hope. Health is my passion, and it's really a passion of mine because I was trying to take care of myself through the healthcare system, become pregnant, had miscarriages, went to Calgary Infertility Clinic, and finally when I stepped out of the healthcare system and took charge of my own health, I had incredible success. And so here I stand in front of you as a retired school teacher, the healthiest one of my staff, surrounded by extremely sick children every single day, coughing in my face. I don't get sick. I don't take vaccinations, refuse to do that. I've watched kids get damaged in front of my face. I take responsibility for my own health. What I'd like to know about you is, where do you guys stand on the naturopathic preventative side of healthcare? Because I can save you money. I never go to a doctor. I'm on a list for a doctor. I've lived here for a year. I can't get a doctor. It doesn't actually matter because I've taken charge of my own health. So now what? So what do you do in the naturopathic area? Where's my physiotherapist? Where are my chiropractors? Where's my acupuncturist? Where's my naturopath? Where are the midwives? Let's do prevention. Do you know that in the school system, I'm not allowed to teach health? The health curriculum has become a social curriculum. Yes, that's my question. Where do you stand on naturopathic preventative care? Because that's where you're going to save your money. Thank you.
So the first person to answer is Ross.
Well, welcome back from Alberta. I grew up in Alberta, but I ended up living here, so. Anyway, in terms of preventative healthcare, I think you have a lot of good points. I mean, we all do need to take responsibility for our own health. There's no question about that. And I know because my mom was a nurse, she educated us as children. And we had, four kids. And we didn't go to the hospital unless we absolutely had to. Like when I got a ruptured appendix, I went to the hospital. When I had the flu or a cold, I didn't need to go to the hospital. And, I just got lots of rest and liquids. And I mean, more people just need to be educated about their health. And I think naturopathy and, acupuncture and Chinese medicine, and there's all different kinds of practices. I think we can learn from those, and I think, some things work and some things don't, but people need to see what works for them because every individual is a bit different, right? And I think part of your success, from my experience with different people in my life, and including myself, is when you actually feel that you have an internal locus of control over your health, when you feel that, I can do something about this myself, and I'm not just a victim, or I'm not just being treated upon, but I actually have some responsibility. That's about 50% of the battle, because the human body, and I've been told this by doctors too, has miraculous healing qualities.
Thank you. We now go to Kim.
Thank you. We haven't actually talked much tonight about preventative medicine, and I think it's one of the areas that is going to take on some of the innovation and research. So we start making people healthier. I mean, diabetes is a perfect example. We did not have the numbers of diabetics 20, 30 years ago that we do now. Part of that's lifestyle. So part of that's education. In terms of, the acupuncturist, the chiropractor, naturopath, I've used all those because I do see value for me. Not always. Sometimes it works, sometimes it doesn't. But to your point about having the option, I guess that's one of the great things about being Canadian. We get to choose. If that's what works for us, then we get to choose that. But it doesn't mean that we don't have the more what I'll call conventional forms of medicine and practices, because we need those as well. So I think as a society, there's a place for everyone, and we get to choose what works best for us. And if it doesn't work, then often, as for those of you who have gone through the process, you go on. I had a terrible shoulder. I couldn't, I tried acupuncture, I tried physiotherapy, I tried it all. And after 8 months of agonizing pain, I finally went into Mike Jones and said, give me the cortisone shot. I cannot take it anymore. So, at some point, you just have to make the decision for yourself, and great that we can do that.
Thank you.
I believe there is a role for alternative medicine in our healthcare system. To this point, I believe chiropractic care is partially covered by OHIP, the provincial plan in this province, and I'm not sure about some of the other providers. And so that means that there may be a barrier for the idea of everybody having equal access to alternative care providers, because if they can't afford to pay the private fees, then they can't access those services. So that's one comment. But the other is The current dean of the Faculty of Pharmacy at the University of Toronto was a classmate of mine 20 years ago when I got my master's degree, and she went on to get her PhD studying the education of naturopathic students at the College of Naturopathy. So there's an interest on the part of pharmacists in using other things to bring about healing and improve health. So backing off to the community health center model, the health promoter is one of the team of people that looks after people on Toronto Road and Port Hope. So health promotion, illness prevention are both huge, and yes, we need to be taking responsibility for our own health, being involved with healthcare providers, whether they're the medical system or the alternative providers. We need to advocate for ourselves and participate in what is going on. And that's a new way of looking at healthcare for a lot of people. Certainly my mother's generation, even though she was a registered nurse by training, her expectation was, when I'm broken, I'll go to the doctor will fix it. Doesn't work like that.
Thank you. Other questions from the public?
Yeah, this is less passionate in one way and more passionate in another. I worked for years as a practitioner in the nonprofit housing field, retired, came back to my hometown. I'm a very active volunteer working with people living in poverty. And I feel like I've had my right arm cut off because we no longer have one of the essential planning tools that we relied on very heavily. That's the long-form census. Please tell me that you will bring it back.
Yes.
Other questions from the public?
That was a question. They didn't
Yes,
say
the answer is yes.
They said yes.
that. All right.
Well, I'll say something.
Okay.
I mean, I agree, yes, we need to bring it back, but you have to think about, okay, well, why was it eliminated in the first place?
Yeah.
Because, I mean, the excuse that was used, Tony Clement, the minister, said that it was because a couple people had complained that it was an invasion of privacy. I mean, give me a break. Are you serious? I mean, we lose all that evidence, all that information. We can't make good social policy. We can't make good health policy. As a business developer, I can't make good business plans and marketing plans. I mean, it's like cutting off your nose to spite your face, right? So it's just really silly and bad public policy. So that's why we need to bring it back. We need to bring it back because we need evidence-based decision-making that helps all of the people of Canada, not just the wealthiest, 1 or 2%, and all those tax cuts that they benefit from. We need that policy to be able to provide our public service with the information to make good decisions for all Canadians. And that's why it needs to be there.
I just wanted to add, I see the cutting the long form census as one of the muzzling of science approaches that were, rampant in the conservative government that is currently in its last days of office.
See, now we're all going to answer. When I was doing, this is going back when it was first being canceled, and doing some research and talking to folks, and they're telling us, first of all, countries around the world are not using Canadian data because it's not reliable, because we don't have the long form census. So when the next government puts it back, they are saying some segments of it will take up to 20 years before the data will be reliable again. So one ideological decision by one man has cost us hugely, because we talk about social housing earlier. How are you planning for that? How are you planning for healthcare? You don't know where people are living, what they need for education, all of those things. So it's not just about getting the long form census back because it's important. It needs to come back because it's essential for us.
Thank you. We're looking forward to other questions from the public.
Another one.
Thank you. I have another question on pharmacare. Recently in the news, we've seen cases where hedge fund managers have bought up the rates to generic drugs, and in one case, raised them by 5,000%. We've also, I've seen in the news that an American drug company is suing the Federal Drug Review Board in an attempt to get it disbanded because they think it's unconstitutional, because it's trying to hold down the price of drugs. What would your parties do about, and I think these are trade agreements that this government has entered into that is now coming back to bite them. What would your parties do about that? Thank you.
Okay, we start with Patricia.
What's your favorite topic?
Yes. I have always believed that big pharma, like I like to give them that label, will charge whatever they think the market will bear. And what's happened the last couple of weeks is good evidence of that. Okay? So obviously, free trade agreements, NAFTA, and Brian Mulrooney we can thank for why Canadians have been overpaying for prescription drugs for the last, 25, 30 years. So that's when it all began. NAFTA started it. And other free trade agreements also jeopardize Canada's sovereignty, our ability to control prices, such things. I mean, the dairy industry is under threat today. So many things are going on. And whichever government is, or the coalition that's going to form October the 20th, will have to be very strong and firm to defend the Prices Review Board that we have set up in this country that manages prescription drug prices and patent protection. So it's going to be a tough road. We're going to inherit, and right now we know that the Trans-Pacific Partnership is being negotiated in Atlanta and will likely be concluded before October 19th, and then we get to inherit the outcome of that. So it's not a good situation. I feel that during an election period that is 11 weeks long, the incumbent government should be declared a lame duck government and just not allowed to approve anything. But that's just my view on it.
We have Skip next.
Just a little bit of trivia. Did anybody ever wonder why Stephen Harper didn't go down to the TPP talks? Because according to our constitution, the ministers still hold power even though they have prorogued parliament for the election. The prime minister does not have any power, but the ministers do. That's why Ed Fast is there doing it. Stephen Harper can't do it, which I think as a caretaker government, they should have to wait until after the election to sign anything. And this is just one more way of Stephen Harper bullying us into things. Because I'll tell you, when it's over, you can't reverse it. I mean, I can't even imagine the penalties that would be attached to that, to do that kind of thing. So I guess I shouldn't say can't, but I can't imagine. You know, I saw Kathy ask a question a minute ago, and I met Kathy at a Grannies event in Peterborough. And I was working with the Grannies over the past 5 years to try and get the access to drugs initiative through. If you remember, it's the one to get the HIV and other drugs over to African countries, especially sub-Saharan African countries, because we know it makes such a difference. And it is the big pharma that put the lobbies in to stop that. There's, at the end of the day, there is, I guess for us as I look at some of the things that we can do with our drugs and the amazing things that we can do with our drugs. And who would have thought somebody would have bought a company and the drug would have been $7.50 a pill, and then he decided to make it $750 a pill? Who would have thought someone would have done that? What controls we can put in place to stop that, I don't know. But we better put them in, because he won't be the first. Once one person has done it, someone else will find another way to do it, even more so. And the trade agreements are an issue, there's absolutely no question. We'll see what happens with the TPP, but I don't think there's anybody in this room that thinks it's going to be a good thing.
Well, Kim, your leader, Justin Trudeau, actually agreed with the TPP without even reading the agreement, and it was never debated in Parliament. It is true. He agreed with it. He agrees with all the free trade agreements. And Mr. Chrétien, in 1993, promised to cancel NAFTA. Some people might remember that. And of course, he backed down on that. Now, these trade agreements are just agreements. They're contracts. That means that you can renegotiate. And these agreements need to be fair trade agreements, not free trade agreements. That's what they need to be. You know, the Liberal Party and the Conservative Party agree on a lot. And one of the things they agree on is free trade agreements. The NDP does not. We feel that in many ways, yes, we support trade fully. Of course we do. But it needs to be fair trade. All the parties need to benefit from the trade. And we also believe that these investor protection agreements that are in these trade agreements should be eliminated because they bypass democratically elected governments and they have secret tribunals that make the decisions to protect the future profits of corporations from public services that could be provided by government. That's what it's really all about, folks. So when FedEx sues Canada Post because Canada Post has Purolator, a courier company, why should they be allowed to do that? It's because it's under NAFTA, the Investor Protection Agreement. That's what CETA has, that's what the TPP has. So in terms of controlling drug prices, we can control prices. We're a federal government. We can say you can only set the prices at this amount. We can have generic and bulk buying. That's the answer, Ken. That's how you control the prices. And in terms of drug patent legislation, Brian Mulroney brought that in. And that's cost us billions of dollars. And the reality is that those drug companies aren't doing a whole lot of R&D, quite frankly. That's why they have those patents.
Are there other questions from the public?
Hi, my name is Deborah, and I don't care who answers this question. Actually, I'd like all three of you to do. I just felt like that whole discussion was a bit ambiguous. I would like to hear definitively how you, if you make government, what you're going to do about these trade agreements. Because I've traveled all through Central America, I've lived in Central America, and I've had trade organizations, labor organizations tell me that all it has done is make poor people poorer and rich people richer. And the same thing is happening here, where we don't control the cost of our pine, where now our milk products are going to be affected, et cetera, et cetera, et cetera. I want to hear that your party is going to rescind these trade agreements so that this trade, that we are no longer affected by these corporations and pharmaceuticals, et cetera, trying to screw Canadians who are looking for jobs and want to keep profit here in Canada where it belongs. Thank you.
So could we ask Russ to start?
Absolutely.
Okay, so, well, I think you answered your own question in a way, but the NDP would reopen those agreements. We want trade. Canada's a trading nation, so we want to do that. There's no question about it. But we want to make sure that Canada also has a manufacturing base. We've exported over 400,000 manufacturing jobs since 2006, just in Ontario alone. Those were good paying jobs. They had benefits, they had pensions. Now, what have we replaced them with? 30% of Ontario people work in precarious employment, which means part-time, low wages, no benefits, no pensions, and often not even a full-time work week. So how do you make a living doing that? You try to cobble together 3 or 4 jobs. So these trade agreements, from my point of view, Canada, is basically shipping raw materials to mostly China, but also Mexico, the United States, some European countries, and we're buying back expensive finished goods. So, this is an old saw in Canada, but there's no reason why we can't through trade agreements. So let's take the auto pact, for example. We had an auto pact in this country where we had percentages of parts that had to be included in the manufacture of a car. Now the TPP wants, because the Japanese and the Chinese want to decrease that significantly. So what Mr. Harper has done, he's gone around the world over the last 4 years and he's signed 34 of these agreements with different countries, and they've all been negotiated in secret. They all have the same kind of investor protection. They don't protect workers in Canada. They don't protect our manufacturing industries. They don't protect supply management. The NDP is the only party, other than the Green Party, that is talking about protecting supply management in a serious way. You can't accept these trade agreements and protect supply management. When I talk to dairy farmers here in Northumberland, Peterborough South, they are very concerned about losing the family farm.
We need to renegotiate the existing trade agreements, and realizing that there may be penalties involved in doing that, depending on what the terms have been set as time has gone on. It's a complicated thing, that's for sure, but where there's a resolve, then you have to get to it. And we have been a nation of exporting raw materials rather than refining or processing goods here. So for instance, rather than, we're getting a little bit off health here, rather than building pipelines to bring diluted bitumen from Alberta east to process in the Maritimes or ship offshore, Elizabeth May and the Green Party proposed that we build refineries in Alberta and process it there. That reduces risk to the environment and to human health in transporting a dangerous product, because bitumen is gooey, sticky, and will not pump into pipelines or rail cars without organic solvents. That's the hazardous part of the product. So we need to be looking at doing more of that value-added manufacturing, processing with agricultural products. We're doing some of that locally in Cobourg in terms of taking crops and processing locally to create a product that goes on the shelf in the store. We need to do more of that, because that's where trade benefits and jobs are, and a lot of that can be done through small business development. So, unfortunately, our sovereignty is under threat with TPP and other free trade agreements. So it's going to take some time to get it all sorted out, but I believe that there is where there's a will, there's a way, and we need to tackle it for sure. Thanks.
So, it all sounds very easy, doesn't it? We'll just renegotiate the 34 trade agreements and that will fix everything. We've had 55 months of trade deficit under the Stephen Harper government during his term. That's never ever happened before. And Ross, I know you have to find somebody to bash, but you know what? At least use the quotes correctly. Justin Trudeau has never said he is against, he has never said that he is for trade without reciprocity. And you've done it a few times, and it's getting old. In terms of supply management, we have clearly said that we're supportive of supply management. And not only that, but as I was up on Sunday talking to Joe Crowley and Francis Crowley and a lot of the supply management farmers, they're not just worried, they are scared. There is already about 10% of milk being dumped into this country through the US. There are no penalties being enforced on. And another 10% they anticipate we will lose 50% of the 150 dairy farms in this riding. That's our local food, that's protection of our local food source. So free trade agreements, as we have clearly said as a party, it's never free. It's about trade agreements with reciprocity. If I give you something, you give me something back of equal value. There is the fact that there have been terrible negotiations in this country that have allowed us to end up with terrible agreements doesn't mean the process or the idea of a trade agreement is a bad thing. We need to be selling our products to other people. 55 months of trade deficit meant we imported more than we sold. That's part of the reason this country is stagnant, and part of the reason we have a plan for growth. Thank you.
What is your party's stand on GMOs and labeling of products within it?
Okay, so we'll start with Kim.
The labeling of products. This is a huge discussion in the agriculture community right now. A couple of points on that. One is, if you buy, I was in the grocery store and there's garlic from China, which I refuse to buy. And the woman's, and I'm having a conversation with my husband about it. And the woman beside said, oh, just buy the jarred stuff, it's a product of Canada. Well, it's not a product of Canada. The garlic's still from China. But the jar, the lid, the vinegar, and the product makes it a product of Canada. That's inexcusable. People think they're buying a Canadian product and they're not. The labeling has become to the point, I have a lot of food allergies, I'm allergic to MSG, and so if I can't pronounce it, I don't eat it. So this whole local food movement is really important to me. I go to my local markets. I buy locally. Oslam Farms up in Welcome. Great lamb and other things. Some of this labeling has pushed people to buy more local, and I think that's a good thing, but it's not enough. There is also, in terms of the GMO, it's a problem within the agriculture community in terms of these trade agreements. I was talking to Dan Darling on Sunday, and he is the Vice President of Canadian Cattlemen, the beef farmers. And in that European trade deal, they were supposed to be able to sell their beef to Europe. 2 very small farms in Canada have been able to sell. You know why? We wash our cows with recycled water before they go to, our steer before they go to processing. In Europe, they use a chemical. And because we aren't allowed to use the chemical, the beef farmers now can't sell to Europe. There's also a hormone question with the beef, that there are countries, sorry, I'm gonna lose my time and I will finish this conversation at some point. It's important to us, it is the protection of our food source, and we need to become more stringent about it. Thank you.
Okay, yes, Patricia?
I have a big concern about GMOs and what that means in terms of proprietary protection. The companies that own the seed then require you to buy the seed every year from them because that seed is responsive to certain chemicals and pesticides and whatnot. So it's a vicious circle. And yes, by all means, we are all entitled to know what it is we are eating, taking, putting into our bodies, whatever it happens to be. At the same time, I also think that labeling in some ways has gone crazy because products that contain no wheat whatsoever are labeled gluten-free, or products with no fat in it are labeled, like a bag of sugar, cholesterol-free. Well, of course it is. I mean, that's an extreme example. But I'm just saying that sometimes we get labeling that is nonsensical and means nothing. So we definitely need oversight of labeling. And yes, we should know what is in there besides food. And I like to take locally grown ingredients and make it myself. I have a problem with salt and blood pressure, so I don't want to buy processed anything. So by making my food from scratch myself, I can much better manage what goes into my body, and I'm much healthier, and I've lived longer than either my dad or my grandfather before their first heart attack, so I'm into health promotion. Thanks.
Well, since Mr. Moulton's not here, and Kim didn't answer the question, I'm going to answer it for both of them. The Conservative and Liberal Party both support GMOs. That's the reality. It's on the record. I can show you the quotes. I'm not misquoting anything. That is the reality. Number two, in terms of labeling, all they support is voluntary labeling standards. So I served on the Toronto Food Policy Council for a few years, and I'm now on the Northumberland Food Policy Council. And there's serious issues around GMOs and whether or not they're doing harm. So the approach to take on GMOs is do no harm, which is a good healthcare practice in general, because we don't know what the impacts in the long term are of GMOs, because they're going cross-species. Now, David Suzuki could explain this a lot better than me, because I'm not a geneticist. But I think that the public, the Canadian public, is entitled to be informed about what is in the food that they're ingesting. Therefore, yeah, you can clap, thank you. Therefore, we need to have mandatory labeling whether there's a GMO in the food product, and then the consumer can make their choice. Isn't that what it's all about? It's all about the choice, so let the consumer make the choice, and it would be an informed one. But if the product's not labeled, that has GMO ingredients, how can they make the choice? Now, the reason that GMO ingredients are not labeled is because the industry doesn't want them on there, because people don't want to buy them. It's that simple, honestly. That's a consumer-driven, this local food movement that Kim and Patricia are talking about, that is a consumer-driven movement. And the farmers that are able to make a living from that because they sell directly to consumers, they get 60 cents on the dollar instead of big industrial agriculture with GMOs that get 20 cents on the dollar. The other thing, there's no scientific evidence that GMOs actually increase productivity or yield of crops. And in fact, over time, it may decrease yield and increase input costs. So the economics aren't that great either. So do your research, Government of Canada, and make the right decisions for the people of this country.
Are there any other questions? We'll have one more question from the public. If not, I have a question. Okay.
So I'd just like to ask, sorry. My name is Regina Elliott, and I'm the president of the Durham Northumberland chapter. So closing, I just wanted to get us back to health. And I think as nurses, we know healthcare is expensive. And we also know that governments want to balance the books. So what would your parties do in the sense of being fiscally responsible, yet providing the best and having health as the priority in our country?
Is that a Patricia?
Well, we haven't really talked, because we're focusing on health, we haven't really talked about taxation. But one of the things the Green Party would do, or will do, is to increase taxes on big corporations, which currently pay only 15%, back to 19%, what they were in 2009. So that then becomes a source of revenue. If we're going to be strengthening the Canada Health Accord and increasing transfer payments from the federal government to the provinces for healthcare, we need to find that revenue somewhere. We can't take it off the backs of taxpayers only. So that's one of the ideas that the Green Party is proposing. Something else we haven't really talked about, but the Green Party supports the legalization and regulation of marijuana, and that will generate tax revenue. The Green Party also proposes increasing taxes on alcohol and tobacco, because we know that those two substances can have harmful health effects. So that's by increasing those taxes and then putting that money back into the healthcare system, it's another source of revenue. I think I'll pass the mic. Thanks.
Okay, thank you. You can pass it to Kim.
As I said at the outset, we still have 2 weeks to go and our healthcare platform is not out. And I'm not going to, I don't have the ability to speculate what those numbers are. I know it's included in a $7 billion envelope of the announcements yet to come. I do know that we've done a lot of discussion at the party level on, and something we haven't even touched on tonight, which I was kind of disappointed we didn't, is the right to die with dignity. And I think that's one of the policies that we need to have a lot more conversation about. And we clearly said that we will do as the Supreme Court has instructed and put together legislation to put forward to Parliament in consultation with clergy and medical individuals, etc. In terms of the money and where it comes from, being in government is all about choices. And Russ, I'm trying not to, I don't like the, you know, what somebody did 20 or 30, 40 years ago and speaking for me about what we say and what we don't say. But I will tell you, it's easy to make choices when you've never had to make them. And so government choices, different governments have made different choices about things, and we can agree or disagree about what those choices are. But the health of Canadians, I don't believe, is a choice that we have that can be disputed or that any party, well, I'm not going to speak for Adam. He's not here. He can speak for himself. but certainly from a Liberal Party perspective is not something we can compromise on. So I'm looking forward to our platform announcement, and I hope that once it comes out, that if you have questions about it, you'll come and ask me. I do know as a policy, in terms of the pharmacare, the right to die with dignity, and the importance of within 90 days negotiating a healthcare accord with the provinces at the table will be the strongest message we can give about what healthcare will look like in this country going forward. Thank you.
Thanks a lot. It's important for government to be prudent with its finances because right now we've got $600 billion in debt, accumulated debt on the federal level. And you could double that if you add all the provincial and municipal debt. So then if you add the individual household debt, well, we're in a lot of debt in this country. That's the reality. So we do need to be prudent. And it is about making priorities. So instead of having successive tax cuts from large corporations, from 26% under the Liberal government, that's what it was with Paul Martin and Jean Chrétien, down to 15% now, because Mr. Harper's continued the Liberal tax cuts for big corporations. All that money, which happens to be $600 billion too, isn't it funny how it's the same amount? That's $600 billion. Those corporations are just sitting on that cash. The economic theory behind that was, if you cut corporate taxes, they're going to invest in machinery, they're going to create more jobs, they're going to do research and development. They didn't do any of that. They sent their jobs overseas so they could make even more profits, and those profits went into the tax havens. So they're not even paying any tax because they're in tax havens. Those are government priorities. So our priorities as the NDP is to protect our public health care system and increase corporate taxes. People want a fair tax system. It needs to be fair. Not having corporations pay their fair share of taxes is wrong. They need to pay their fair share. Those corporations all benefit from our public infrastructure, our public health care system, all the rest of it. Why shouldn't they pay their share of it? Why should the middle class get stuck with that all the time, right? So we really need to look at what are the priorities, and the NDP government will focus on healthcare as a top priority and creating a fair tax system.
I have one final question I'd like to ask. It's a burning question. I'd just like to let you know that chronic diseases are increasing in this country. Chronic diseases such as type 2 diabetes. In the past 20 years, people in the mid-30s to 40s got type 2 diabetes. Now we have children developing type 2 diabetes. Similarly, cancer is increasing and heart disease. There are many other chronic diseases, but these three diseases are really increasing in the general population. We need research funding to help develop strategies and interventions to help prevent some of these diseases. The funding for research and innovation has decreased significantly in the past 10 to 15 years. As a matter of fact, the Canadian Institute of Health Research is the major funding agency for all of Canada. When you look at people, university professors who apply for funding, over 4,000 professors would apply for funding, and only 400 are given any funding for research. If we want to prevent some of these chronic diseases, we need to develop innovation and strategies and interventions to prevent them. So my question to you is, would you increase the funding basket for research that is going to reduce some of these chronic diseases and help the population health, improve the population health? So I guess we could start with Kim.
Thank you. Well, as I said earlier, today was our announcement on innovation and research. And I think I've said a few times tonight, that will be where we find a solution to a lot of the challenges that we have, is in innovation and research. Our scientists have been decimated, but to your point, part of the problem is our scientists have done very good work. What ones are left? But they aren't allowed to share their findings. They have been muzzled. And how as a society, not just Canada, but Canada and beyond, has been so successful about finding cures to diseases, about finding innovations, is that they share their research, and other researchers and scientists look at it with a different eye, through a different lens. And that's how things build and get better and better. Mr. Harper has made significant cuts. We have, as I said, just announced that we are putting, I think it's $200 million back in a year for 3 or 4 years. And at the end of the day, the envelope of dollars that the government has to spend the decisions on that envelope will have to be made in terms of priorities that Canadians have. We've been going around the country listening to Canadians. Every Sunday night I'm on a call and I upload everything I'm hearing at the 35,000 doors we've knocked at. What people's concerns are, what people see as some things that we can do in their communities or for them personally. And the way that we find ourselves getting to the point where we have these solutions to some of our chronic problems has to be through research and innovation. So I'm very pleased about our announcement this week. Thank you.
Thank you. We ask Russ, and then Patricia.
So the short answer to the question is yes, we would increase the funding for research, health research and medical research, and we wouldn't privatize the benefits. We would have public research for public benefit. In terms of chronic diseases, this is a big concern because we've seen, with the increase in processed foods and more fructose and less exercise, we've seen increasing obesity rates, particularly in young people, and it's a huge issue in Canada and the United States. And we need to focus on making sure that the food ingredients in foods, we need to eliminate trans fats, for example, and fructose should not be used as a sweetener. It's 10 times more fattening than regular sugar. So why are we applying that? It's in every food that you buy, every processed food. So that's why we're getting diabetes, and that's why we're getting heart disease and some cancers, etc. There's environmental aspects of that as well. But why have we eliminated gym programs in schools, in public schools? That doesn't make any sense at all. The only reason we've done it is to cut the cost of education, right? That's why. So that those precious tax cuts can be given and balance the budgets. So I think we need to look again at what are our priorities here. If we want a healthy population, we need to make sure that our public schools have the resources, the programs that are required. I mean, there's really innovative stuff. I saw this elementary school in Saskatchewan, and they've got the kids in their English class reading novels while they're on a treadmill. So, why not do that? It's a great idea. So there's lots of things that we could implement across the country, but I think fundamentally we need to look at preventative health care. We need to have some individual responsibility as well as social responsibility. And we need to remember that when public dollars go into research, then the public should benefit from that.
As mentioned earlier, I became interested in primary health care reform 20 years ago, about the time the province started the Health Services Restructuring Commission and closing hospitals. They got it backwards. We should have been looking at the social determinants of health and how to promote health and reduce illness, prevent illness, before we started closing acute care beds. But anyway, yes, the Green Party supports increasing funding for research in the public interest, which would be shared with the public and be used for the public good, particularly in the areas of human health and the environment. And we know that we're part of this world we live in, so what we breathe and eat and drink affects our health as well as the foods and our lifestyle. The Ontario Health Study, I got involved in that 4 or 5 years ago, and they're still looking for people to sign up. It's free. It's another monitoring service. Every once in a while they send me a requisition email. Would you go to a lab and this lab and get this blood work done? And fine, I do. Now they want me to do a sleep study. I can do it at home. They send me the equipment. I have to wear a thing on my wrist. I have to keep a diary for 10 days. So I thought, well, maybe after October 19th I might do that. But that's something, that's getting information about a larger population. I think there's 6,000 Ontarians signed up for it so far, but why not sign up for it? And I think this idea of doing basic research to find out why are some people healthy and some people aren't? Why have I not had breast cancer but my 2 younger sisters did? There's a question to be answered there. Thank you.
Thank you. Thank you. I want to thank the candidates for taking time off their busy schedules to meet with us tonight. Your discussions were informative and engaging. I also thank the members of the public, the registered nurses, and all our media, and all our community members participating in this discussion, question and answer period. I also want to thank Kawartha, Victoria and Durham chapters for planning this all-candidate event and giving us the opportunity to hear from our politicians. All candidates. I wish you the best because RNAO is non-partisan. I wish you great success in your endeavors. I hope you have great success at the polls. I hope everybody in this room go to vote.
Yes.
Okay. And lastly, the executive would just like to have a picture with you before you leave, and if possible, if we could post your picture on our website.
Certainly.
Okay, I need to get your permission to do that.
Sure.
So
Yes.
I'll ask
Thank you
the
very much.
executive.